In this video, I'm going to be talking about 5 main reasons why nursing is not for you, or you should quit nursing, you should leave nursing, or you shouldn't even think about getting into nursing. This is my personal opinion, and you shouldn't take my word for the gospel facts, but this is my opinion, and these are the 5 things I came up with that are very important for nurses to have, and if you don't have them, then nursing is not for you. I mean, I narrowed this video down to like just 5 points, but there can be more. There are more points out there, so tell me your own 5 points that work for you, or your own points that you think that are very important for nurses that I did not mention in this video. So keep on watching. 5 reasons why nursing is not for you. Hi guys, it's your girl Dede Signature here again. Welcome back to my channel. If this is your first time stopping by, you are most definitely welcome. If you want oldie but a goodie, thank you. I love and appreciate you. Number 1 reason on our list: tolerance. Tolerance is the first evermost thing that every nurse should have. If you're not tolerant, I know every job needs tolerance, but guess what? As a nurse, you deal with people who have health issues. As a nurse, you deal with people who are going through things in life, especially their personal health. It could be psychological, it could be any kind of health, it could be emotional, and it could be physical health. But if they are going through all of those and you can't tolerate them, and the nurse is the one person who has that one-on-one with the patients, if you can't tolerate their attitudes because they are going through a lot, you are not supposed to be a nurse. You can't be a nurse. And again, before I continue, disclaimer: these 5 points I'm gonna give, if you have a problem with one, maybe you can tolerate the other 4 and you can be good enough to be a nurse. But if you don't have 3 of these qualities, I'm sorry to say, but personally I think you can't be a nurse if you have up to 3 of these qualities. So if you don't have tolerance, you can't tolerate people, you can't tolerate people in their bad situations, I'm sorry, nursing is not for you. Number 2, smell. Yes, there are different kinds of nursing and specialties, but most often than not, if you leave nursing school and you are starting, you always start in a situation where you have to tolerate smell. Most people who are sick have an odor. It's not like bad, like it's not something that you can help. It is just unfortunate. Even when I mean, most people will take care of themselves very well, but there will still always be like maybe some either mouth odor, whatever odor, anything, but it's always going to be odor. And as a nurse, you deal with so many things: urine, all of those things smell, even blood smells, changing the person's underwear, everything, they smell. So if you can't handle smell, I'm sorry, nursing might not be for you. Nursing might not be the right choice for you. Number 3 on our list: if you are not ready to put this on almost every day, I'm sorry, nursing might not be for you, because in most cases, 90% of cases, 90% of nursing jobs, you have to wear this almost every day, or every day you are at work. So if you're not ready to be wearing this all the time you are at work, nursing is not for you, because 3/4 of the time you're going to be wearing this at work, probably all day you are at work. So you should be ready to, you should be the one person that is ready to tolerate wearing one kind of outfit, like a uniform, a scrub, whatever. You should be ready to wear this uniform. I call it a uniform because most people just wear one and the same thing, like most nurses. So it could be white, black, pink, purple, blue, whatever. If you are not ready to wear this outfit all the time, nursing is not for you. The 4th on our list: if you can't be a team player. Being a team player, as a nurse, you have to be a team player. Yes, you get information from technicians, CNAs, PCTs, whatever you want to call them. You have to get information from them. You have to talk to the doctor for changes in the patient situation. You always have to be a team player. You have to talk to dietitians, you have to talk to social workers, you have to talk to every person. Like, you have to be a team player. If you can't be a team player, I'm sorry, you can't be a nurse, because you will not be able to pass across reports to the other people that are due. So you can't be a nurse if you cannot be a team player. You have to be a team player to be a nurse, because if you're not a team player, sorry, being a nurse is not for you. Number 5 on our list, humility. This is one of those factors. I don't know, I have to talk about this. You have to be humble. You have to be able to bring yourself to the lowest level, because you are not up there. As a nurse, you are as down there as the worst. I don't know what to say. Like, as a nurse, you have to know for sure that you have to be humble. You have to bring yourself down. You have to bring yourself down to the level of any, like, to the littlest, if that's even a word, level. You have to be humble. Humility, because if you're proud, you'll not be able to talk to these people that need you. You'll not be able to talk to the less privileged. You'll not be able to help people that need you. You have to be humble. You have to bring yourself low. Humility is one of those qualities. I don't care if you think that you are proud and you're a nurse. You are not gonna be a good nurse if you are not humble. Please, we should be humble. Humility, humility, humility. I'm gonna sing this and I repeat it. Being humble is one of those qualities that you need to be a good nurse. So we have had the 5 points. These are my personal opinions. If this don't work for you, tell me your own 5 points that work for you, or your own points that you think that are very important for nurses that I did not mention in this video. And I mean I narrowed this video down to like just 5 points, but there can be more. There are more points out there. So okay, so guys, see you in our next video, and thank you so much for watching. See you in our next video. Bye.